Hi guys, how are you doing? I hope you are doing well and welcome. If you are new here, you feel most welcomed to this channel. And if you have not subscribed, please consider to subscribe and like. If you have any questions, feel free to ask questions down there in the comment section, and feel free to share this video. So today I want us to learn about cancer of the cervix. This video is just to create awareness about cancer of the cervix. So I want us to learn what causes cancer of the cervix, what are the symptoms, and what we can do to prevent or to diagnose cancer of the cervix early before it has not advanced. Okay, so what is cancer of the cervix? And you realize that nowadays cancer of the cervix is so common, and it has affected so many women out here. I believe you have heard about it. If it has not affected a member of the family, maybe you have heard about a friend or a neighbor, because nowadays it has become so common, and that is why I decided to do this video, to create some awareness so that women can know what to do. Okay, so what is cancer of the cervix? It is a type of cancer that occurs or that affects cells of the cervix. So what is the cervix? The cervix is the lower part of the uterus. You know, the uterus is another term, it's called a womb. This is where a baby grows and develops during pregnancy. So the lower part of the uterus that connects to the vagina is called the cervix. Okay, so it affects the cells of the cervix. Okay, so it is caused by a virus. It is called a virus called the human papilloma virus. Okay, and this virus is transmitted from one person to another through sexual intercourse. Okay, so you find that men are carriers, okay, of this virus. So they just transmit it from one woman to another. So it is transmitted from one woman to another through sexual intercourse. Okay, the human papilloma virus has so many strains. There are some strains that don't cause cancer, and also a few that cause cancer. And so this virus is the same virus that causes warts. If you know, or if you have been affected by vaginal warts, you understand. So the human papilloma virus has so many strains. There are those that cause vaginal warts, and there are those that cause cancer of the cervix. So this virus, once you get it, okay, I have told you get it through sexual intercourse, and once you get it, it just survives in your cervix for so many years. It remains there for so many years, and what it does, it contributes to a process that causes cancer to the cells of the cervix. Okay, so this virus causes the healthy cells to mutate or to change and become cancerous. Okay, So what happens, healthy cells grow and multiply at a set rate and eventually die at a set time. In a normal person, the body produces healthy cells, and these healthy cells, they are produced and eventually they die at a set rate. When others die, others are produced. But now what this virus does, it makes the cells of the cervix to mutate or to change and grow abnormally. You know the normal cells just grow at a set rate and then they die at some time, and as others die, some others are produced. But now this virus, what it does, it makes the cells of the cervix to change. They start to produce abnormally. The cells start producing abnormally. They grow so many, and then they do not die. Okay, they grow abnormally and then they don't die. So in that process, these accumulating cells that are abnormal and they don't die, they just accumulate and they form a mass, and that is what is called a tumor. Okay, so healthy cells grow and multiply at a set rate and eventually die at a set time. The changes make cells to grow and multiply out of control and they don't die, and the accumulating of abnormal cells form a mass. That is what just I have explained, that normal cells, they are they just grow and they eventually die. So the body is made in a way that it produces cells at a set rate, and these cells at some point they die because the body has a continuous way of producing normal cells. But now this virus that causes cancer changes the way the cells are produced. So they are produced abnormally, so many, and then they don't die. So these abnormal cells, remember, they grow very fast, and then they are produced so many, and then they don't die. So these accumulating cells are the ones that form a mass, that is a tumor. Okay, so what are the signs? What are the clinical features of cancer of the cervix? What are the symptoms of cancer of the cervix? Number one, we have in early stages of cancer, any cancer that happens in any part of the body, during its early stages, it does not manifest. Okay, there are no signs until now, when it has developed. Okay, when it has advanced, that is when most cancers start manifesting. So if you see any of these symptoms, you really need to rush to the hospital for the doctor to do a checkup and know what might be the problem. Okay, number one, we have vaginal bleeding after sexual intercourse. If you notice that every time you have sex, you experience vaginal bleeding. Number two, if you notice that you bleed in between your periods, a menstrual cycle has 28 to 35 days. So if you start bleeding, let's say today, you will experience another menses after between 28 to 35 days. If you bleed in between here, between day 1 to day 35, if you bleed in between your periods, that is a danger sign. Number 3, bleeding after menopause. You all know that after menopause, you are not supposed to experience any vaginal bleeding. So if you experience vaginal bleeding after menopause, then you need to go to the hospital. Number 4, we have pain during sexual intercourse. It can be because of any other reason, but do not rule out cancer of the cervix. This is one of the signs of cancer of the cervix. It should not be necessarily that you have cancer of the cervix, but you need to go to the hospital for the doctor to evaluate and know what is your problem. Number 5, we have watery, bloody discharge that is foul smelling. Okay? If you experience any of these 5 symptoms, or if you have all, you have 3, you have 2, or you have 1 symptom, please you need to go and visit the doctor so that he can do a checkup to ensure that you don't have cancer of the cervix, because these are the clinical features of cancer of the cervix. Okay, let us repeat them. Number 1, we have vaginal bleeding after sex. Number 2, we have vaginal bleeding in between your periods. That means you have vaginal bleeding in between your 28-day cycle of menstruation. We have bleeding after menopause. We have pain during sexual intercourse, and watery, bloody discharge that is foul smelling. Okay, these are the symptoms of cancer of the cervix, and if you happen to experience any, do not wait. Please go to the hospital for the doctor to evaluate. Okay, what are the risk factors of getting cancer of the cervix? What are the risk factors? Okay, number 1, we have early sexual activity. As I told you, the causative agent of cancer of the cervix is a virus called human papilloma virus, and it is transmitted from one person to another through sexual intercourse. So if you start sex activities early, okay, you increase the risk of acquiring this papilloma virus, because if you start early, then probably you are going to come across so many partners. You start early, then you will have so many partners by the time maybe you are at your 30s or 40s, and that increases your risk of getting this human papilloma virus. We have many sexual partners increases a chance of acquiring human papilloma virus. You see, having many partners, it is acquired through sexual intercourse. So if you have many partners, you can see that you are increasing your chances of acquiring this virus. We have weakened immune system. Those people who have HIV, those people who have diabetes, those people who have high blood pressure, these people who have long-term illnesses, mostly they have a weakened immune system, and they are at a risk of acquiring human papilloma virus. We have smoking. Smoking is a risk factor of getting cancer of the cervix. It has been linked to people who have cancer of the cervix, so it is one of the risk factors. Okay, so what is the treatment? As I told you, early stage cancer of the cervix might have a good outcome, because once it has been diagnosed early, the outcome is good. You start treatment early, and you can survive. But once it has advanced, the outcome is poor. Okay, because there is no treatment for cancer. What happened is there is radiotherapy or chemotherapy. This is a way of trying to control the cancer cells because they really multiply at a very high rate, and so chemotherapies and radios will help to slow the rate at which the cells are multiplying. But then the outcome is always poor. But if it's diagnosed early, there's a way surgery can be done, okay? If it has not invaded the nearby organs, the outcome is good, okay? So yes, that is why I advise ladies to do regular pap smears, okay? So I want us to learn about ways in which we can prevent getting cancer of the cervix. Number one, we have a vaccine. Nowadays there is a vaccine given to those girls, the small girls who have not become sexually active, girls who are between 10 to 14 years. So if you have a small girl who is between 10 to 14 years, there is a vaccine that is used to prevent getting this human papilloma virus. Not girls between 10 to 14 years. We have routine pap smear tests. These are tests done to screen the cervix, and it should be every year. It is a routine test to the cervix to screen it every year, so that if these abnormal cells will be detected early and you will be treated early. And as I have told you, early treatment has a good outcome. We have safe sex. Mothers, please advise your girls to limit the number of sexual partners. First of all, they should not start sex early, and then secondly, to limit the number of sexual partners, and then number 3, use of condoms. This way we will avoid many sexual partners, and we will reduce the risk of acquiring this human papilloma virus. We also have quitting smoking. If you are a lady and you are a smoker, smoking has been linked with cancer of the cervix. So the best thing to do is just quit smoking or avoid smoking for your health purposes, okay? Yes, so that is the simple discussion about cancer of the cervix. Please read this. All those ladies who are sexually active, what I can advise you is please normalize going for routine cervical checkups, cervical of the cervix screening. It is free in the government hospitals, and if you can afford to go to a private facility, please ensure you go for routine pap smears, okay? They will help a lot, because I have seen so many ladies who they just come for random checkups, and then the abnormal cells are detected, and they are started on management, treatment, and the outcome is always good when you start early. But if you wait for these clinical features to manifest, and that is when you go to the hospital, that means this disease has already advanced, and the outcome is always poor, okay? Thank you so much for watching this video. Please share this video. All ladies need to have knowledge. Cancer of the cervix nowadays is so common, and the only way we can stop this thing is by going for routine checkups. Even if you started sex early, which is one of the risk factors, you can always go for routine checkups, and in case there's a problem, it will be solved early, okay? We don't have to wait for these signs. And there are these rumors outside here that Ladies go scaring others that that pap smear is painful, and I want to encourage all ladies to go to the hospital, any nearest facility that offers this pap smear services or screening. Please go and get screened. Remember, when another person comes to tell you how that screening is painful, remember already they have been screened and they know their status. So when they come to tell you that it's painful, you fear, you don't go to the hospital. Remember them, they have been screened, they know their status, and you the moment you just develop that fear and you don't go to the hospital, you don't know your status, just in case there is a problem that could have been diagnosed early and be treated. So now you fear, you stay at home, and that is not good. So please, let's normalize going for checkups, and they will really help a lot. Okay, thank you so much for watching. Please remember to subscribe, remember to like, give you a thumbs up, and also feel free to share this video. See you in the next episode of learning.